Well, hello, everybody. Hello, hello. Welcome. Happy Thursday. Here we are. It's already Thursday again. How's that happen, right? I don't know. It just seems like every time I turn around, it's Thursday, which is one of my favorite days of the week because I get to go live and hang out with some awesome people, right? Some really talented and brilliant practitioners. So, welcome everyone. I want to welcome those of you that are watching the live feed here, as well as those of you that are going to catch the replay. I'm Lesli Vitel, business coach and mentor. And I have a great show in store for you today. A wonderful topic. And this is a topic that is really gaining traction. And I know just from the preliminary, just preliminarily, when we put this event out, we have a lot of interest. And that is so, what we're going to talk about today is all about using supplements with PCOS clients. Okay, so we are going to talk all about PCOS. It's a very complex syndrome, as I'm sure you all are well aware. And we're going to dig into the supplementation, what can be really helpful for clients. How common supplement use is amongst this target audience, people with PCOS, why supplements can be a great addition to their care plan, the do's and don'ts of using supplements for clients with PCOS, and what practitioners need to know when counseling clients about supplement use in PCOS, and of course, much more. And I want to welcome Angela Grassi. So Angela is how long have we known each other? Quite a while now, right? We've kind of crossed paths, so to speak, over the years. And so I'm really excited to have her here with me. So Angela, I'm going to have her share a little bit more about her story. She's the founder of the PCOS Nutrition Center. For over 20 years, she's been providing evidence-based nutrition information and counseling to help people reclaim their lives from PCOS. And she does work with clients directly, and she also trains dietitians in this particular area. So welcome. Welcome, Angela. I'm so happy.
Hi, Lesli. So great to be with you. Hi, everybody. Yeah, you and I always cross paths at Fancy, and then one of these days we're going to meet up in our favorite place in northern Michigan.
Right. So that is one of the things that Angela and I have in common is like one of our favorite places on earth it's kind of a hidden secret, right? But I guess we'll share it. It's Leland, Michigan. So like very few people know how amazing it is up there.
Fishtown. Yeah, Lake Michigan's gorgeous up there.
Yeah, especially way up there. It's spectacular. So yeah, it's kind of a hidden gem. Although it is becoming more well known now, definitely getting busier and busier. But anyway, welcome, Angela. I'm really glad that we have this opportunity to chat today. And I think this is going to be a great topic. I cannot wait to unpack, your wisdom around, supplementation with clients that have PCOS, because it's such a complex syndrome. And it's a really interesting one to work within. So why don't we start? Why don't you share a little bit about your story, a little bit about yourself?
Sure. So I'm Angela Grassi. I'm a registered dietitian nutritionist. I've been working in the PCOS space for over 20 years. And I went into PCOS because I was diagnosed with it. And at the time of my diagnosis, I was already working as a dietitian at an eating disorder treatment facility. And I started to see some patients with PCOS, and there was nothing. There was nothing available on how to work with PCOS or anything. And at that time, I started to experience some of my own symptoms of PCOS. I started taking weight out of the blue, and started to develop acne. And this is like my mid to late 20s.
Oh, so hard.
Yeah. And so I knew something wasn't right. Something wasn't adding up. You know, the amount of food I was eating was not producing this weight gain. And I was doing really intense workouts then. If anyone remembers step aerobics, I know some people still do step aerobics. Did you used to do it?
I've done it all.
And then I got into the double step, how you go from one to the other. It was fun. I really liked it.
On those.
Killer on your knees over time.
That is a workout where you gotta focus. Just saying.
Yeah, so you can't mess that up.
A real train wreck. But anyway,
I started to experience these symptoms, and for me, I always had regular periods. You know, they were never really irregular. Maybe because I'm pretty active, but that wasn't the key thing. So I went to several different doctors. I went to at least 3 saying, you know, something's going on metabolically, tested for thyroid and everything. And doctors just didn't know, the ones I saw, how to test for it.
okay.
And then finally I saw a doctor, Dr. Catherine Sharif, who is a good friend of mine now. And she's in Philadelphia at Jefferson. And she's an internist. And I knew if I had it or not, you know, I just had this gut feeling something wasn't right. Something wasn't adding up and the labs aren't showing anything. And so I knew she would be the one to know if I had it or not. And she did the right test. She did the right hormone test. She ordered an ultrasound of my ovaries, and I did have the little follicles that looked like a string of pearls. And I remember the phone call or actually driving home from her office in Philadelphia and being on the highway and just being like, dietitians have to know this. Like, I didn't even notice it for myself that I had PCOS. And I don't remember learning about it that much, even in graduate school for nutrition.
I definitely don't remember.
Right?
I did not learn about this in school, for sure.
Yeah. And like I said, I started to see some patients with it, and there wasn't anything published that much for nutrition. So I wanted to go into this. I just wanted to educate. Really, my goal was to educate dietitians to help patients with PCOS.
Yeah, I love it. I want to hear more about your story. In the meantime, give me a comment. Let me know. Let Angela and I know if you got any training in your studies around PCOS. Would love to know what your experience was in your training, like in your internship or, you know, okay. All right. So, all right. Julie, nada. Kathy, none. Okay. It's probably a pretty good cross section of what we're looking at here. Like, yeah, absolutely.
And now one of the things I do, besides my work at the PCOS Nutrition Center, is I'm an adjunct professor at Westchester University for dietetics, and I teach life cycle nutrition. And that's a great place to really introduce PCOS. And PCOS really affects people throughout the life cycle. Now, we know it doesn't disappear in menopause, so it's a lifelong thing.
It really is. So you yourself received the diagnosis, right? You were struggling with the weight gain, even though it just did not align. So definitely calories in, like the old way of thinking, right? Remember that? It's all about calories in versus calories out, right? A calorie is a calorie is a calorie. Yeah.
Not true. Let's debunk that real quick.
Okay. So, all right. So you got the diagnosis, you're in your mid-20s. What happened next?
Yeah. So, and when I had all my blood work done, you know, as far as I knew, I was healthy, but then the blood work showed that my A1C was 5.6.
Okay.
This is my mid to late 20s.
Right.
And my triglycerides were high.
Okay. So you really had that full picture.
Yeah. So I was concerned about where is this going to head. And I met my husband, we were getting married, and we knew we wanted to start a family soon after getting married. And that was really my priority. If I was going to have PCOS, I wanted to do whatever I could now so that fertility wasn't going to be an issue. And so right away I started on metformin, because that's what they had back in the day and what they still really throw at patients with PCOS is metformin.
Okay. And so
And
that's for the insulin resistance.
yeah, yeah.
Okay.
And that lowered my A1C a little bit. It didn't help that much with the weight. I was already exercising, and
Okay.
I started to incorporate more omega-3s into my eating more fish, and I was on the East Coast, so it was more plentiful and fresh. And but I didn't see that big of an improvement with the metformin. And
Okay.
then I started to work on a book for dietitians, and I was doing research on supplements
Yeah.
and came across inositol. Have you heard of
Oh,
inositol
right.
before?
I have heard of that. Yeah.
Mhm.
Okay. Right. Yeah.
Yeah.
What about that compound? I'm
Yeah.
so
So inositol is a relative of the B vitamins, and it's
okay.
really well studied in PCOS. It acts as a secondary messenger for insulin signaling.
All right.
And so the research was like really pretty cool. And I just had my A1C done, so I knew it was 5.4. And so my doctor's like, yeah, give it a try.
Okay.
And so I did it for 3 months, and then she tested my A1C again, and it went down to 5.1.
Wow.
3
Okay.
months.
And that
Nothing else changed.
all right. Yeah, because you're
We're
already
like,
doing
"This is awesome."
as much as you really could, right? Like in terms of diet, exercise.
Still maintaining everything. So we went for another 3 months, and she checked it again, and it went down to 4.9.
Wow.
And
So
it's been hovering right around 5 ever since, and this has been, like, 10, 15 years.
wow, amazing. So it sounds like it was actually, I mean, in the sample size of one, it was more efficacious than the medication.
I actually still stayed on the metformin when I was taking it, but I don't think the metformin did it for me as
Okay.
well as the inositol worked.
Okay. That
Yeah,
is
and
really,
that led me into supplements for PCOS and, like, wow, maybe metformin's not the be all end all, or birth control. That's still the primary,
is it?
uh,
Yeah.
still a primary treatment is oral contraceptives.
Okay.
Yep,
Now, I'm not an expert in this area, but it seems like that is just putting a Band-Aid on it,
exactly.
and it's not. And does the birth control pill, is that gonna help? I mean, I would imagine it helps to regulate your cycle, but I'm not seeing a connection with, insulin resistance.
No, it's not addressing the insulin
Okay.
resistance, and if anything, we do see that oral contraceptives can increase lipid levels
Right?
in people with PCOS, and we also see it can increase inflammatory markers and some insulin resistance. So,
Okay. Yeah, so that is probably not doing you a whole like, many favors, right?
right.
Except, potentially regulating your cycle, but yeah, just yeah. So, let's take a look at our comments. All right, so, a little bit more on whether or not our audience has had any exposure in their training on PCOS. So, one sentence about PCOS in my life cycle class. So I'm sure Angela can relate to that because she
Right.
also teaches. All right, Jen, none. Lee, not, or I did, but very limited. And Julie just had college age girl's mom reach out to help with the new diagnosis, but don't know where to begin. All right, awesome. You are in the right place, my friend. And Kathy, okay, so Kathy wants to know how to spell the supplement.
Yeah, it's inositol, inositol.
Okay, actually,
And I have, if you go to my website, I have tons of blog articles and information about it because I'm a huge fan. I even sell it. I sell supplements at the
okay.
PCOS Nutrition Center, and
So this
that's
is
one of the best selling. And
okay.
I hear from my clients that it works so well.
Okay.
Some patients with PCOS that taking inositol alone will help to regulate their cycle. So
Okay.
they don't even need necessarily birth control to regulate their cycle, which
Wow.
doesn't really regulate it. It's just
Yeah.
a fake period. Yeah.
Official.
Yeah. And
Exactly.
it's another big benefit I saw from it is that cravings. Like I always had the biggest sweet tooth. My friends would always tease me. I'd always want dessert.
Okay.
And it was just this intense kind of cravings for sweets and carbohydrates. And I see a huge difference even today. I still take it. When I don't take it, I miss a dose, that the cravings are a lot higher. And patients tell me this too. So,
Okay. So I know this is a little off topic, but not too long ago, I had an interview with Karen Kennedy, and we talked about the glucose monitor, right? And we pulled up my data because I did a little experiment, and it wasn't there were parts where it looked like a train wreck. Let me just say. Now I did go back to normal pretty quickly, but definitely I got the spikes, right? And I do love my carbs, no doubt about it.
oh,
So it
yeah.
makes me wonder if, I don't have PCOS, but it does. Have you, do you know if there's good research on just like, your otherwise healthy individual who, could maybe use a little regulation, metabolic regulation? I'm sure, right? There would be
Oh,
no
yeah.
downside. It's probably really
No. And inositol has been shown to help with anxiety and lots of other benefits to
wow.
it. So it's been around. Yeah. It's not just for PCOS.
Amazing. All right. Yeah, I'm going to give that a try. All right. So we got a couple questions coming in already. And this is a great one. Do you know of any contraindications?
It's really well tolerated. I mean, the only thing to be careful of is that it could lower blood sugar. I
Okay.
haven't really seen that to be the case, but its role is to help with insulin signaling. And I have a whole video about it, how it works, but it's basically helping the lock and key mechanism work better
Okay.
for
I
the
love
insulin
that.
receptors. Yeah.
All right. That's very cool. All right. So I know we have a lot to cover today. Um, so let's jump into your PCOS, like the services that you provide. And I think you shared already. I love your story in terms of why you decided to specialize in this area. And I would agree, like most of us decide to specialize in a particular niche where maybe we have experience, like personal experience. Not always, that doesn't always happen, but it's pretty common because you've got that firsthand experience, and so that's I think that's incredible that you're bundling up all your wisdom and helping other women navigate this journey, right? So tell me a little bit about what you offer at the PCOS Nutrition Center.
Yeah, so I started off doing nutrition counseling, so I do that, and I'm going to be launching some group programs in the new year, which will probably
Okay,
be here before we know it.
that's great.
And I started a whole supplement line of PCOS supplements, and I've also written a couple books. I wrote a cookbook, I wrote a book for dietitians, and I wrote a book called the PCOS Workbook back in 2010, and it's been revised, and it's still like selling really well, like on Amazon, and yeah,
So good.
over all these years. Yeah.
So you've got a lot of resources on your website as well as Amazon, which is really cool. So, all right. So tell me a little bit. Let's zero in. I want to make sure that we answer the question where to start because let's see. So who was it that had a new client? Oh yeah, yeah. Okay. So this was Julie. So where does one start with this type of client?
Yeah, it's really important that dietitians do a full kind of nutrition assessment, look at history, look at the symptoms, what is the most challenging for them. I'm guessing that since she's college age, maybe she's not really ready to have children yet. So maybe her symptoms or weight are some of the issues. And I would look at the labs if you can with your clients. And then once you become more familiar with supplements, you'll know how to, which supplements can help with what symptoms.
Okay.
But I will say, if you're a dietitian starting to see patients with PCOS, you have to get educated about supplements because it's everywhere. Patients are using them. It's all over the internet. People are like, oh, I tried this, it worked for me. And one supplement, like just because inositol maybe worked for me isn't going to mean it's going to work for you, Leslie. So we really need to tailor the supplements, and they should be used under, care of a professional.
Absolutely. What are your recommendations around dosing?
For the inositol?
Yeah, for the inositol. So
there's two main types of inositol. There's myo-inositol and dechiro-inositol.
Oh,
and
tell me about
we're
that.
finding that there's actually a 40-to-1 ratio blend, and that's in a product I have on my website called Ovasitol.
Okay.
That mimics levels in the body, that our bodies have a certain level of myo to dechiro-inositol.
Okay.
And it's a 2 grams of myo and 50 milligrams of dechiro twice a day.
And does it come in a pill format?
There are pill forms of it. The kind I have is a powder. So it's great for like young women or people that want it on the go. It's just really convenient.
Okay. All right.
People that don't like to swallow pills.
Okay.
Or taking a lot of pills already. You won't believe like some of the supplements I've had patients bring in, like giant Ziploc bags full of supplements into my office and be like, they don't even know why they're taking them. It's crazy.
Oh, so interesting.
It's crazy.
So tablet form or capsule and powder is very common as well. Okay. Yeah. So Kathy, hopefully that answers your question in terms of the dosing. And again, I really would recommend that you check out. In fact, I'm going to put this. This is Angela's website, PCOSnutrition.com. Lucky you got that URL.
Early. Well, I've been doing this a long time, but it does help with SEO. You search a topic, and chances are it'll lead you to the website.
So, so I would recommend that anyone interested in learning more, please go to PCOSnutrition.com. And I think you said that you've got like some freebies that are available.
Yeah, so I actually have, I have tons of information on my website as far as blog posts about the different supplements and everything. But I do have a course for dietitians that talks about PCOS throughout the different stages of the life cycle.
Okay.
And I actually cover 20 supplements in the course. That for dietitians to be familiar with. So I have a coupon code for 2 free books. They'll get my cookbook and workbook with the coupon code BOOKS.
Oh,
if they sign up for my PCOS training course.
Okay. Lowercase, uppercase, or doesn't matter?
Doesn't matter.
Okay, books. Yeah. All right. Sounds good. So they can find out about your course by going to your website, correct?
Yep.
Okay.
There's a professional section.
Oh, great. All right. That sounds really good. All right, guys. I love this area of work. It's so interesting, and I mean, it's just so complicated too, right? Because you've got like that like everything going on, including potential disordered eating.
Oh, definitely. And that's how I got into this. My first client ever was a patient with bulimia. And she was binging several times a day, and she just got diagnosed with PCOS, and her doctor told her to eat an Atkins-style diet.
Oh, wow.
So no carbs, and she couldn't do it. And she felt awful, and then she was binging and then purging. And
so from a nutrition perspective, what do you do?
Right. So you have to, there's a lot of things. You address the eating disorder first for the PCOS. And balanced meals, having the carbs actually can help patients with PCOS because it helps with blood sugar. I know for me, if I don't have enough carbs, I'll get hypoglycemic, and it doesn't feel good. Anyone who has experienced severe hypoglycemia, it's not.
Are you actually dipping below 70?
Yeah, when I was in college at Michigan State, this is like why I always wondered what something's going on. I remember one day just waking up dizzy and lightheaded. I went to one of my food labs and had breakfast, nothing with enough protein. I was a college student, probably like a bar, and walking home and almost passed out. Like I couldn't walk. I was dizzy. I had to sit down, and somehow, like I took a break, made it to the house I was staying in, and went to the health center. And they called me later, and they said your blood glucose was 40.
What? 40? Oh my God, that's freaky.
40. And that's after eating like a granola bar. And I think I had something else when I got back to the house.
Okay. That is super scary.
Yeah.
Oh
yeah.
my God.
And
Okay.
for some people with eating disorders, like the blood sugar really contributes to their symptoms, because if you're starving, you need carbohydrates to bring it up.
Right.
And you have these stronger cravings for carbs with the
Yes.
higher insulin levels. And, probably a lot of people that have dealt with weight issues, they've been blamed for their weight and tried dieting. And we know dieting leads to eating disorders too. Yeah.
Yeah. It's got everything wrapped up into one diagnosis.
All those hormones too. Yep.
Triglycerides, hemoglobin A1C, high insulin sensitivity, weight gain, tons of inflammation. What am I missing?
High testosterone.
Okay. So you've got that. It's just so complicated. All right. So we have a question. What was your favorite part of the course? The biggest takeaway you immediately started using?
Oh, what helped me the most?
Yeah, I'm not sure, Julie. So
course of treatment, maybe. I would say inositol if that's the case.
Okay. Yeah. Okay. Yeah, I think that is, hopefully, Julie, let me know if that answers your question. Yeah. So, got it. Okay, so that was meant for somebody else. Awesome. All right. Oh, okay, great. All right. Well, here's an endorsement.
Thanks, Ashley.
And it was amazing. Good.
That's
so awesome endorsement. So Julie was asking Ashley what her favorite part of the course was. Got it. All right. Awesome. Okay, so so there's a lot of a variety of supplements that can be really super helpful for clients, people that are struggling with PCOS. Can you give us kind of like an overview of, like, are they deficiencies? What are we using supplements for?
Yeah, well, there's a couple reasons patients are using them so much. There was an international survey of 1,400 patients with PCOS.
Okay.
And I think 99% of them wanted an alternative to just taking birth control and metformin.
Okay.
Right? So they weren't seeing, again, a PCOS, we haven't seen a lot of advancements since I was diagnosed. We now see maybe as far as medications, the GLPs being used a little bit with patients with PCOS, but metformin and birth control are really the only options they're getting from their provider. So it's they're searching out other answers, and they're looking at supplements. And we do see there are studies that show that women with PCOS are deficient in certain key nutrients, like zinc is lower, and zinc can affect testosterone levels. And we see vitamin D is low. We know vitamin D is a hormone. So vitamin D plays a huge role in ovulation and egg quality and fertility. I just wrote a whole new blog post about some new guidelines, some recommendations that just came out about vitamin D use in PCOS.
Where do we want to, is it the same level? Like, like generally hit around 50? Is that our target?
Yeah. And how much to take a day, and that people aren't getting enough.
So people with PCOS may need higher dosing than your average person. Is that
maybe? Yeah.
Regardless.
And then if they are taking metformin affects the absorption of vitamin B12.
Oh,
I
okay.
don't know how many people know that, but I presented information. I'm part of the Androgen Excess and PCOS Society. There's such a thing, and there's hardly any dietitians. So if anyone wants to join us,
Okay.
but I presented this information, a whole topic on supplements for PCOS, maybe 10 years ago at Harvard at one of their conferences, and they hardly any of the doctors there knew about metformin affecting B12 levels.
Wow. Okay. I mean, gosh, a drug interaction, like that is critical, right? If a commonly prescribed drug is contributing to a deficiency, like we need to be on that.
Yeah, and B12 can affect mood. I mean, it can cause permanent nerve damage. It's not
Uh-huh.
one that you want fatigue.
Wow. Yeah,
Not
you don't
one you
want to
wanna
mess
mess
with that.
around with. No.
Yeah, and you don't want to mess with vitamin D either. I was shocked. So I had a physical this morning, and right, like I think it's the first time. Well, I have a functional medicine doctor. Of course, she's on the vitamin D, but interestingly, just kind of your normal doctor, she asked me, are you taking vitamin D? I thought, okay, we've come a long way. You know what I mean? Because yeah, that's kind of I've never had like a mainstream, doctor ask me about vitamin D. So I thought that was kind of good.
And that's the thing with PCOS is that doctors maybe get one nutrition class in medical school, maybe. They're not familiar with
Right.
these supplements. So it's and patients are taking them.
Yeah, and many doctors, probably don't think that they're A, needed, or B, efficacious, right? It's that common thought process, like, oh, you'll just have expensive urine. I remember
Yeah.
that was, what I was taught back in the day. So, hey, Bonnie, so glad you could join us. So, what was the group for excess androgens?
Oh, it's the Androgen Excess and PCOS Society. AEPCOS.
Awesome. Okay. All right. So basically, then patients, clients are seeking out additional ways and even more natural, I would just say more efficacious ways of managing this syndrome, right? And
Absolutely.
so they are coming to the medical profession asking for advice, asking for guidance and recommendations around their supplement use, which really is, I think, it's a great opportunity, especially for dietitians to step up and become that expert in this particular area. What's the prevalence of PCOS? You know?
It depends. There's different criteria, but it's around 5 to 15%.
Okay. Of the
Mhm.
of women?
Yeah, yeah.
Okay.
It's crazy.
Is it mostly diagnosed in the teen years? Or in your case, it was 20s, so, like, younger, let's say below 25?
I see it being diagnosed more in younger
Okay.
women, but the problem is a lot of patients don't get diagnosed until they're trying to get pregnant and they go off the pill that they
Okay.
were given for not having a regular period or a period at all.
Yep.
And they go off the pill and, oh my gosh, the period does not come back. And here they are in their mid to late 30s and wanting to start a family and
They thought everything is, like, fine, I'm getting a period.
taking the pill, and the pill does suppress testosterone. So maybe it helps with like acne and excess hair growth that they might experience,
Okay.
but it's just a band-aid.
So then they wanna conceive, and then it's like a crisis, right? Like, a fertility crisis, potentially, because they're not cycling, they're not, ovulating, right?
Yeah, and that's where nutrition has been shown to play such an important role in ovulation and fertility.
Okay, fascinating.
Yeah.
That is all new to me, I gotta tell
Yeah.
you.
It
Oh,
is new. It's new.
I never would have known that or even guessed, to be really
Yeah,
honest.
like vitamin D. Vitamin D is such a key part of ovulation and fertility for sure.
Yeah, I mean, I can get like wrap my mind around inflammation, um, insulin sensitivity, overweight,
Yeah,
weight, all those things
yeah.
that we typically talk about. But yeah, the direct correlation with fertility and ovulation, not so much, really. That's fascinating. I love it. Okay, so what else do we want to talk about in terms of supplements? Is there anything that you'd like to add?
I mean, there's so many. Fish oil is great for inflammation. It's great for ovulation too. So, and there is some research that taking, for example, fish oil can help reduce testosterone
Oh,
and it
okay.
can help with mood. So that's an important one. So you want to really, you have to get to know your patient and know if do they eat fish, do they have good sources of omega-3s,
Mhm.
and what are their triglycerides? We know that fish oil is great for triglycerides to
Okay.
lower them. So it's really important to really get a good nutrition assessment and also to know if a supplement is working, right? And something I do with my clients is I always like to look at the labs, obviously, because it's good data, but I have them take a picture every month of the same symptom spot. Like if they have acne on their chin, I'll have them take a picture of that, and every month we'll compare to see if the supplement treatment protocol they're on is working, if their hair is, getting thicker, or if their part's getting wider and they're losing more hair.
Okay.
And this
Wow.
helps to evaluate what's working, what's not.
Okay. And the hair loss is due to the testosterone?
Yeah, it can cause like male pattern baldness, like
Okay.
thinning, and then they get extra hair growth, usually in the central part of their body
Okay.
from the excess
And
testosterone.
acne on the chin, is that the testosterone? Okay. Why?
Usually related. It's just a good place for hormones and yeah.
Okay. Yeah, it's just how it is. As my son would say, "Mom, it is what it is." Typical engineer, right? Thinking, "It's what it is." Don't ask why.
I know.
All right. All right. So, oh boy. All right. So, are there any things like do's and don'ts that you want to elaborate on when it comes to supplements for PCOS?
Yeah, I think it's really important to first familiarize yourself with these because obviously patients are taking them. They're going to come to you. I've had patients that have come to me because they're like, this dietitian said she did PCOS, but she didn't know any of these supplements I was taking. Um,
Okay.
and so because they need to be monitored and maybe they don't need to be taking them at all. So dietitians really need to be familiar with that and doing a detailed nutrition assessment, even asking if a patient wants to take supplements
Okay.
instead of just pushing it on them, right? Supplements are supplements. They're not a replacement for good nutrition and lifestyle. So we still have to definitely address those. And I think what's really helpful, what I really like to do with my clients is to educate them because they're not getting this education. Doctors aren't sitting down with them for a half hour, an hour, and telling them what insulin's doing in the body and how it's affecting their symptoms and what testosterone's doing
Okay.
and how like this supplement inositol works in the body with insulin signaling. Because I think it's really important that you know what you're taking and why you're taking it.
Yep. Okay. I love that. I think a golden nugget is the inositol, like one of my big takeaways from today, right?
It's
Um,
good. It seems too good to be true, but if you work with enough patients and you hear their stories and they're like, "Yeah, regulated my period and I don't have the cravings like I did."
Now, this is like going back in my brain through the cobwebs, but I seem to remember learning somewhere along the way that it can help with insomnia. Is that true? Or am
Yeah.
I looking that up.
Well, it helps with anxiety, so it could
Yeah,
help with insomnia.
okay. Yeah, maybe because it's calming, right? So
Yeah.
like I'm just imagining if you struggle to go to sleep because of busy brain, that maybe
Oh, yeah. And we do see, Leslie, higher rates of anxiety and depression in PCOS too. There's more
yeah,
hormones and yeah,
understandable. Gosh, I
sleep
mean,
is an issue for sure.
hormones are messed up. That alone just wreaks just havoc for the person. Okay, awesome. Let's see if we've got any more questions. And okay, so I think we answered. Do you guys have any more questions that you want to ask the expert before we start to wrap up? This has been so good.
Like I
Any
said,
like
there's tons
recommendations?
of information on my blog. Yeah.
So, in terms of exercise, just out of curiosity, do they recommend more? Is it kind of like a mix? Do they recommend getting a variety versus just all aerobic? I can imagine if you're struggling with this, I could be wrong, but I'm thinking you might be more apt to just go all in with the aerobic in hopes to, burn
Yeah.
calories. So
Yeah.
is the recommendation that you get a mix, right? I'm assuming. Is that
Yeah, the data is still really limited, but the guidelines are still the same as for anybody without PCOS. It's still
okay?
to do like weight training twice a week. And that's the one good thing about having PCOS is if you have higher levels of testosterone, you can build muscle easier.
That
And
would
so
be
you can use that to your advantage. And a lot of people like lifting weights. They feel strong and it helps with
okay.
body image. And
Awesome.
sometimes doing too much cardio, too high intensity cardio can backfire in a lot of ways. So it
Right.
makes
Tell
you
me
quick
about
you
that.
bigger.
Can you tell me a little bit about that?
Yeah, it could increase cortisol levels and could like also raise insulin levels in a way too, because your body doesn't know that you're just exercising to, be fit or whatever. It thinks that you're under a strenuous,
Okay.
like dangerous event. So it
Okay.
reacts differently. Yeah.
Yeah, I would imagine it's just like anything else. You want to get a mix, right? Some
And
aerobic.
find what you love. Find what you really enjoy doing. And there's even some research that yoga lowers androgens, those male hormones.
Oh,
So yeah, it's really cool.
that's awesome. Okay. Um, okay, let's see. Oh, hey Karen, how are you? Love to hear you talk about over exercising.
Yeah, you could overdo it and it'll backfire.
Yeah, that is a fascinating phenomenon to me. Any truth to saw palmetto?
Not that much research. It could reduce testosterone levels, but it's not like some of the big ones I would use,
Okay.
like the main ones. But yeah, research is really limited on saw palmetto.
Yeah. Okay. Well, I'll tell you what, guys. If I were still in practice seeing nutrition clients, I would, well, number one, I would get trained. I would really get educated in this area. Um, I remember many, many years ago when I had my practice, I did do some training in this area and it was just so interesting. Again, it's just so complex, right? You're dealing with everything all in one person. So, and then, but the supplements, I don't remember getting much on the supplements, right? So I'll bet that is really like having that knowledge will really give you the edge, right? So, is that the crux of your course? Is supplements? What is the name of the course?
It's an online PCOS training course for dietitians.
Okay.
Yeah. And
For those
I cover 20 supplements and I talk about how to use them at different stages in the life cycle. But I cover like I have a whole module on eating disorders. I have a module in menopause, so in adolescence.
Cool. All right, we got another question. Any advice for women with PCOS who get pregnant?
Any advice once they are pregnant? I think,
Probably.
well, as far as supplements, fish oil and vitamin D and choline, especially at the beginning part
Okay.
of pregnancy, C is really important, but inositol has been studied in pregnancy, and it's been shown to reduce the rate of gestational diabetes.
Okay. Amazing.
Yeah.
And then I would just say the other thing is if you don't have a FullScript account, I highly recommend. I love FullScript, and you can open a free account at it's a bit.ly link, bit.ly/FullScript supplements. I don't work for them, but I love them. I should work for them, right? It's like the greatest thing since sliced bread, I think, right? To just not have to mess with it. Like everything's online. You can create your protocols. So if you guys don't have an account, it's free. Why not open an account, right? So, all right, guys. So is there any final words of advice that you'd like to share, Angela?
Yeah, I mean, so many people like it's doom and gloom with PCOS, but the majority of patients do get pregnant that want to have children. They do go on to be parents, and you can reclaim your life from PCOS.
Yeah, awesome. I love it. All right, this was incredible. Thank you so much for joining me today, Angela. It was really great catching up with you. And I'm so happy that really that you're serving not only clients who are struggling themselves with PCOS, but also dietitians. So really just such a great opportunity for dietitians and nutritionists to, expand their knowledge base and help a really, really complicated syndrome that I didn't even realize it was that common, right? I think you said 5 to 15%. That's pretty significant. So, all right, guys. So,
Thank you.
thanks, Angela. Thanks for spending your time with me today. Hope this was really helpful and got you fired up and motivated. Again, I just want to remind you to check out Angela's website at PCOSnutrition.com. Lots of juicy freebies and, of course, her course. So check that out. And thanks again, everybody. Thanks, Angela. I'll look forward to seeing you all next week. Okay, bye for now.